So, good afternoon, Mr. Mirza. Thank you for joining us today. My name is Hannah, and I'm delighted to host this one-on-one session discussion organized by Academy of Social Franchising. Joining us, with me and my team, Priya Sagar. Okay, to give you an overview, I represent ESTAH Society, a Bangalore-based NGO dedicated to making a positive impact across three key areas like people, planet, and partnership. Our work aligns with the broader goals of social uplift and sustainable development. And we are particularly focused on a long-term initiative called We Heal the Earth. So this program, We Heal the Earth, contains 40 elements in which we have water, education, health, environment, agriculture, livelihood and transportation, housing and energy. Among others, our aim is to integrate these areas into cohesive strategy that fosters sustainable communities. Okay. So the purpose of this today's session is to better understanding each other roles, both personal and professional, and explore potential collaboration in areas of mutual interest. Okay. So we are excited to hear about your journey and insights, which will help us identify the common goals and opportunity for the partnership.
So thank you so much for the opportunity, and I'm equally delighted as you. And thanks for the opportunity. It's been wonderful, and I think it's something that I really want to understand more. Thank you.
Coming to the background and your experience, can you share your journey in the development sector and how your experiences have shaped your mission to transform lives, especially for vulnerable and marginalized children and communities?
I started my professional journey in this development sector on 14th of June 2006 with the earning of 3,235 rupees. It's my first salary. I started at block level as a Block Mobilization Coordinator in UNICEF-supported social mobilization network for Polio Eradication. Okay. I was lucky enough to be based in my home districts, Aligarh, and after around 1.5 years, I was promoted as District Mobilization Coordinator, and I was based at Kanpur Division. My headquarters was Farkhabad. So I remained there in UNICEF Social Mobilization Network for Polio Eradication for 6 years, around 1.5 years as a block coordinator. Then I was promoted as a district mobilization coordinator. I was based at Farkhabad, Kanpur, and whenever there is problem, there are issues, because you know that polio eradication program was a huge program, and there were lots of myths and misconceptions, especially among the minority communities. If you have worked with, you must have known the reasons for that. So I was almost everywhere in Western and Central UP. Whenever there is a problem, there were polio rounds. So, I was there. So it's a 6 years journey. I also had a additional responsibility of sub-regional training coordinator when the position was vacant. So I've also added that responsibility. So after that, in 2012, I got this opportunity to work with FHI 360. So it was a DFID program, MPHSRP, Madhya Pradesh Health Sector Reform Program, and in which, we worked very closely with the system. It was a technical support kind of thing, and I was based at Sagar Division. And we were responsible for facilitating in the establishments of model maternity wing. It was a time when RMNCHA program, reproductive, maternal, child health plus adolescent program, it was envisaged, and it was very new. So for 2.5 years, I worked very closely with the system, sort of a system strengthening, and responsible for the establishment of 2 model maternity wings, one at Chhatarpur at district headquarters and the other one at Panna. After that, I got an opportunity to work with Save the Children, now known as Bal Laksha Bharat. They've recently rebranded themselves.
As an expert in maternal and child health, nutrition and WASH program, what have been the most challenges aspects of implementing these programs in rural and underdeveloped regions?
Yeah. So, in terms of challenges, I think the most important challenge that I identified is I categorize it into two categories. The first one is the non-availability or lack of trainings and capacity building. This is the first thing. Although that thing has been catered, but when we talk about training and capacity building, I'm talking about the quality training and capacity building.
Right.
So this was the very first aspect. Knowing something is different, and knowing something comprehensively is something different. So this was the first thing I felt is important. You know, we did it. We did this TNA, training need assessment, and provided those kind of trainings with the frontline workers. Second, I realized there's a lack of job aid. For example, I give you example of this current project, like pneumonia management. Pneumonia management has to be done at two levels: at community level and at facility level. Now, at community level, ASHA must have those job aids. Job aids means there has to be a digital thermometer, digital watch, Salter scales. Other than that, so that she'll able to manage the pneumonia or assess the children at community level. It was missing. You know, there was some kind of issues in terms of not having that kind of thing. So we did that. Yeah, this is something. And third aspect I felt is very important in terms of interdepartmental convergence, because we have to understand the fact that ICDS, health, Panchayati Raj, and other departments, they all work on a model of convergence. And if convergence is there in a program, it will definitely benefit the program. Also, there was shortage of HR. That's also one of the reasons of there are shortage of HR for so many years. Still, the process is on, but still there are certain kind of gaps related to that. And also, I feel at times it's all very much depend on the supportive supervision. So what I felt is that still this second layer of supportive supervision needs to be strengthened a lot.
Right.
See, it's not about fault finding, but if the supportive supervision and the follow-ups of the training has to happen on regular basis, there should be enough scope for the frontline workers to improve and perform their work. So I think these are 4 or 5 key challenges I feel we have to work around to strengthen them. Other than that, guidelines are there, systems are there, everything is there. But it's very important to ensure the implementation of those guidelines, which starts from the quality training, then the follow-up, then the supportive supervision. So these are the chains that has to be ensured for smooth implementation.
Right. Thank you for your insight, sir. So coming to the leadership and innovation, you described yourself as an innovator and visionary. Can you share an example of an innovative solution you implemented that made a significant difference in your work?
Yeah. We implemented a mobile health application for the tracking of pneumonia cases. It was it's called as mHealth application.
Application.
Yeah, and trust me, it was very, very difficult and challenging to implement it in rural Bahraich.
Yes.
Taking the concurrence of the system, it was also challenging. It was not something that was very easily accepted.
Right.
But somehow, we have to find a solution for doing that. So what we did, we requested the MD NHM at that time, Madam Gulmana ji, and asked her to give permission to did it on a very pilot basis.
So in your role, you engage with a diverse range of stakeholders. How did you foster strong partnerships to ensure effective collaboration among them?
Yes, so I think right from my career, if you look my profile, I have been a techno program manager. right from the UNICEF days to this. I'm a techno program manager, so of course, uh, I had a privilege to interact with multiple stakeholders. Government stakeholders and NGOs and other CSOs. So now, in terms of interaction with the stakeholders, I personally felt it's an art. It's an art. It's typically an art, because working with the government as a development partner is always a very tricky situation.
Yes.
You need not to be so much close, or you need not to be so much distant. If you are so much close, their expectations, they're like anything. You cannot, met up their expectations. And if you are so distant, then it will be difficult for you to implement. So that balance has been maintained. And the best part is that, there is a clarity of thought. We always shared our plan with the system, what we can do and what we cannot. That's important. You have to be very realistic when you are talking with the government, with the system. You have to be very realistic that, sir, this is my objective, my goal, my implementation plan is this is I'm going to do. These are the areas where I need your kind support, and these are the things that I cannot do. So this is the first thing, is the clarity of goal and objective with the various stakeholders.
Even the explanation of our goal should be like we will discuss with many other people, right? So not only one single person at a time, but we should always speak with one person, other one with the hierarchy. We should go that, right?
Yes.
Yeah.
Exactly.
Thank you so much for having you completed with your session. So thank you so much for even participating and sharing your views and insights with whatever you're doing and the challenges you have taken in COVID and even in the developments in maternal health, child health, in nutrition. That's really inspiring us, Mr. Mirza. We come to the end of this session. So thank you so much for all
Thank you so much, Mirza.
Thank you.
Pleasure to hear whatever I could. Rest, I will check the recording there.
Sure. Thank you so much for the opportunity. Thank you.